The Brain Brigade is an incredibly elite, fast-paced environment where your mind literally needs to be constantly firing. Today, we're walking through the exact handbook used to master this intense medical rotation. We're going to translate their core principles into actionable steps so you can step onto the hospital floor completely ready to excel.
Right off the bat, there's this core philosophy you absolutely need to adopt, and it goes like this. We carpe erudium. Essentially, we seize the teaching moment, daily. The Brain Brigade doesn't just sit around waiting for education to happen, they demand proactive, relentless learning. They strive to insistently deliver excellent, safe, and thoughtful patient care as their absolute standard. It's a total mindset shift right from day one. Your mission here really rests on three main pillars. First up, sharpening your neurologic clinical diagnosis skills. Second, using diagnostic tests prudently and responsibly, so not just blindly ordering everything under the sun. And third, delivering incredibly empathetic and diligent clinical care. Imagine a sudden medical commotion erupting mid-flight among passengers on a commercial airplane. The most likely causes are seizures and syncope. Neurologic emergencies are highly prevalent. Conditions like stroke are the leading cause of disability and the fifth leading cause of death. You will encounter primary neurological conditions and their medical complications throughout your entire clinical career. Because of this, you will often find yourself managing palliative care. This video provides the daily protocols for managing shifts, meeting strict documentation deadlines, and establishing patient trust. Internalizing these operational steps allows you to move past the logistics of your shift. By standardizing your approach, you create the necessary mental space to deliver empathetic, diligent, and entirely intentional clinical care. Your shift begins with strict arrival parameters. In the inpatient setting, you must arrive before 8 a.m. to start seeing your assigned follow-ups and new patients. For outpatient clinics and covered weekend shifts, the workday starts at 8 a.m. Show up wearing either a lab coat or a business blazer. Your clinical presence directly impacts how patients perceive your professional reliability. Charisma is simply the combination of clinical competence and personal warmth, both of which you can develop. Cultivating these traits creates a therapeutic environment and helps you generate trust with the patient before the clinical exam even begins. Your very first digital action upon arrival is to locate your patients on the HIPAA-compliant iMobile system and formally assign yourself to them. Next, you pre-round. You need to gather every detail of each assigned case before table rounds. This means knowing their code status, current labs, and consultant recommendations, but also their living arrangements, family members, and even the name of their pet. When reviewing the electronic medical record, never assume that the auto-populated history is correct. Always verify the history directly with the patient. Trust, but verify. Proactive, exhaustive preparation ensures that nobody knows the patient better than you do.
As the handbook says, that depth of knowledge is your badge of honor.
This level of ownership allows you to lead the discussion during rounds with confidence. Between 10 and 10:30 a.m., you will attend table rounds in the neurofloor rounding room. Here, you will present new patients using a standard, succinct method, and present your follow-up cases using a specialized format, so the entire team can share knowledge from every case on the service. When the team moves to see the patients, follow a precise 3-step script before entering the room. First, frame the case for everyone. This is Mrs. Smith with this diagnosis, and her son Paul is in the room. Second, once inside, introduce the attending and the rest of the team. Third, actively show the team a key physical exam finding before you begin advising the family. At the bedside, act as the primary doctor. Take care of the patients as if you are fulfilling the role of an independent consultant. Constantly ask yourself how you would handle the situation if you were completely alone. Part of that leadership requires knowing your limits. If you are unsure of an answer, a sincere "I don't know" is a perfectly acceptable, safe, and professional response. By structuring your bedside visits methodically, you project both authority and warmth. That precise communication translates your underlying clinical knowledge into tangible comfort for the patient and their family. Documentation requires strict formatting. The progress notes, assessment, and plan must be written chronologically. Never edit the prior day's entry. Always enter today's date and begin a new entry. In every note, you must verify physical exam findings, note the reason for consultation, and prominently include the patient's handedness. This interface outlines the super soapy checklists you must use for your follow-up cases. Organizing your data into summary, subjective, objective, assessment, plan, expectations, and bibliography ensures a comprehensive presentation. This timeline illustrates the compromising 6-hour window from patient admission. Within this boundary, stroke patients must have the NIH stroke score, Glasgow coma score, and modified Rankin scale documented. Similarly, TIA patients require an ABCD2 score, and intracranial hemorrhage patients need an ICH score. Hitting these immediate deadlines protects the patient. Missing them leaves the medical team without a valid diagnostic baseline to track recovery or detect sudden neurological decline. Step 4 involves clinical stewardship. Order tests efficiently by asking yourself one defining question: how will this test result change my management? You must know when it is appropriate to wait and let a condition declare itself. Strategic restraint in ordering tests, when combined with targeted daily reading, accelerates your ability to make accurate diagnoses.
You have to be both clinically and financially responsible.
Which leads us to the ultimate gut check question you just have to constantly ask yourself. How would I handle this if I were alone? You are basically practicing for the day the training wheels come off. This graph illustrates a target blood pressure corridor. When giving instructions for systolic blood pressure, never use vague thresholds like less than 140. Always instruct using a defined range, such as 120 to 140, creating clear boundaries on the top and the bottom. Terminology must be equally exact. Do not use the word seizure unless a seizure is definitively confirmed. If the diagnosis is unclear, refer to the events strictly as seizure-like spells. For specific procedures, follow established protocols. Hold all anticoagulants, including DVT prevention medications, if a patient is scheduled for a lumbar puncture. Additionally, immediately activate the delirium order set for patients older than 65, those with polypharmacy, or those with a history of delirium. Enforcing this level of precision with your language, your thresholds, and your order sets prevents clinical assumptions from taking root. In the afternoon, return to the bedside to follow up. Check their response to treatment and update your senior resident. Be proactive with the patient. Deliver their test results, answer questions, and provide reliable printed educational materials from sources like UpToDate before they have to ask for it. You are expected to read daily. Pull primary literature related to your patient's specific condition. Utilize artificial intelligence to expand your knowledge base, and aim to generate questions that could serve as future research topics. If you are covering an occasional weekend or holiday shift, non-neurology residents will take a compensatory day off during the week. On Fridays, provide a thorough sign-out to the covering resident, and on Mondays, get a complete update on everything that transpired. Closing your shift with structured sign-outs and completing your daily reading ensures seamless continuity of care while actively building your medical knowledge. You now have the operational steps to manage your workflows, execute chronological super soap notes, and hit strict diagnostic deadlines. Pair that operational exactness with a charismatic, professional presence to project reliability to your attendings and foster therapeutic trust with your patients. We have been waiting for you for a long time. Step onto the floor, lead at the bedside, and deliver excellent, intentional care. As we wrap up this explainer, I want to leave you with one final provocative question. Will you carpe erudium today? Will you step up as the charismatic, diligent physician the Brain Brigade expects? They are waiting for you to bring your absolute best energy, your exactness, and your warmth right to the hospital floor. Seize the teaching moment today. Welcome to the Neurology Rotation. Welcome to the Brain Brigade.